Hello, good afternoon or good morning, wherever the part of the day might be starting or ending for you. Glad you could join us. I am Glenda Tuthill with the Resource Center, and we're going to spend a little bit of time today going over the 2017 Pyramid Consulting benefit offering for the year. We do work really hard to make sure that there are a wide variety of benefits that can kind of meet all varying needs across differing phases of life. Our benefit plans are offered independently of one another or a la carte, meaning that you are able to pick and choose whatever you want and whoever you want to cover. We offer a ton of tools and information, resources, all people, humans, all forms of medium and capital in order to give you access to information about your benefits. So we do encourage that you take advantage of those tools and people. Ultimately, we design our benefits to help keep you and your bank account healthy, and we'll hopefully hit some of those highlights today. Just want to make sure you know, if you are viewing this document electronically outside of a webinar, if you get a copy of it from our employee site, the table of contents as well as hot links that are listed throughout the document are active. So you're welcome to utilize the tool or the document interactively. Quick overview of the plans that are offered for 2017-2018 plan year. We have 3 health plans available, as we have for the past several years. We have a wellness program. We're going to be actually increasing our wellness efforts. We've done a great job of making people aware of wellness or helping people to be aware of wellness, and we're going to continue that journey in order to try to continue to foster a culture of good employee health. We have 2 dental plans, as we have for several years, and we'll go into more details later. A comprehensive vision plan. We are going to be utilizing Cigna for the 2017 plan year. We have telemedicine, one of my favorites. We do allow employees to pre-tax their medical, dental, and vision premiums, as well as, if eligible, open up a state health savings account. We offer short and long-term disability, as well as an employee assistance plan. We offer supplemental life, low-cost life insurance, guarantee issue, this open enrollment for you, and it's available to you and your dependents at very low-cost payroll deduction. We are also offering guarantee issue critical illness benefits this open enrollment, as well as if you're a new employee. And then finally, we have a retirement plan. We've given you a quick overview of our key contacts. I would just encourage you to know a couple of big ones, if you will. Number 1, again, we are your resource center. We're available for benefits counseling, answer questions, help you navigate the ADP Workforce Now website, as well as you do make all of your elections and access payroll and other important employee-related information through our workforcenow.adp.com website. Finally, if you have simple questions, easy, nothing too complicated or difficult, we really do ask that you contact the plan direct for simple questions, things like who's in my network, who is, I want an ID copy, a copy of an ID card, something's wrong with your website. Those are all things that are fairly easy, and we're going to ask that you reach out to those direct plans for that type of inquiry. Aside of easy, we're going to ask that you contact us direct so that we can help you navigate your benefits and your offerings and make sure that your rights are protected. Again, just a quick overview of eligibility. Remember that you must be actively at work in order to be eligible for our benefits, as well as in order for your dependents to be covered, you must be covered as the employee. Dependents are considered to be a legal spouse or legal dependent children up to the age of 26. Some benefits, such as our life and or critical illness, require proof of full-time student status in order to maintain coverage over the age of 18. In order to enroll, decline, change your benefits, find out information about cost, payroll, get links and contact information, plan summaries and documents, and much more, remember we will use the ADP Workforce Now website. Please do remember, if you are benefit eligible and fail to enroll timely or decline your benefits timely, you will be default enrolled. Just a quick overview of common benefit terms. Sorry, I'm trying to make there we go. Quick full page of benefit terms. I won't go into them. Just know that they're here. And if you have a question or get a little confused about common terminology that either we would use in our benefit guide or in daily speak when we're talking to you, please know that this is a good resource for your reference point. I always tell everyone, if it's tax-free, it's for me, and that's because taxes are a huge part of our family's budget. We just don't always think about it because Uncle Sam and everyone else is nice enough to take it out of our check before we ever get it into our hot little hands. So anytime you can convert a tax-free dollar into a tax-free dollar, you're putting money in your family's budget, in your family's pocket. So we do encourage you to participate in our pre-tax plan. You also have the ability, again, we mentioned it earlier, to put aside pre-tax dollars into our health savings account. We'll go over a little more of that in detail in a moment. Please do remember that if you don't want to pre-tax, you'll be required to complete and submit a decline to pre-tax form. Otherwise, you'll be considered to have agreed to the terms of our pre-tax plan, which are standard. Remember that if you do make a pre-tax election, what I tell people is during open enrollment or when you're first offered benefits as a new hire, you are in the driver's seat. You control what you pick, what you don't pick, what you want, who you want to insure. We mentioned that a little earlier. Everything's a la carte, and during open enrollment, you get to pick who you want to insure. I would just encourage you to realize that once you pass that window, so once open enrollment closes for our old timers, if you will, and then maybe for our new hires, once you've passed your eligibility date, the date you're eligible to enroll, then you are moved over to the passenger seat, and the insurance company or the law dictate what you can do and who you can cover. Please do remember our plan year is an April 1st plan year. So generally, you can only make changes during open enrollment unless you're a new hire or you experience a qualifying life event. And we've given you a list of QLEs below. Please remember, you only have 30 days from the date of your QLE to request a change to your plan. If you have any questions, please remember, the Resource Center can help you, and we'll recap with that contact information at the close of our workshop today. I like to remind people that we offer a wide variety of benefits, and you don't have to be sick in order to take advantage of them and receive something of value from many of them. In fact, we're all about prevention. We know that statistically and personally, many of us have seen that prevention is really the best method of defense against bad health. We have a great EAP plan. We'll go over that later. You actually can tap into many benefits for free with our EAP plan. You have a low-cost preventative eye exam and free or low-cost corrective eyewear, as well as other discounts. You actually have access to free cleanings and discounts with our dental plan. Our supplemental benefits offer wellness rewards. And again, our medical plan offers a ton of freebies and educational resources to help us be more healthy and tap into discounts and other value adds that are part of our benefits plan. As well as, on the rare chance, hopefully, that you don't feel well, we've given you the ability to access free basic physician services. Okay, we're going to jump into what I call the heart of the matter. Most people, this is where we'll spend the majority of our time, although I'll try to make sure that every bit of our time gets the appropriate attention it deserves. We have 3 health plans available. We have 2 HSA plans and 1 traditional or copay plan, as I typically refer to it. We're going to explain how the differences in those plans work now. We've given you tips about each of the plans so that you can kind of get an idea of the characteristic of the plan, or maybe the characteristic of the person who might gravitate towards these 3 options. I'm going to explain them here, but I just wanted to make you aware or remind you to be familiar with the tips section under each of the plans. All 3 are open access point of service plans, simply meaning they are national networks and there's no referral required. All 3 plans utilize the same Cigna Open Access Plus network that we've utilized for years, very comprehensive national coverage. The first plan, again, is an HSA eligible health plan, and that just simply means that you pay up front. With an HSA, the law prescribes how these plans can work. In order to be HSA eligible, they cannot offer what we call first dollar coverage outside of wellness. So with our HSA eligible health plans, we know we're going to pay all of the expenses towards the deductible before we receive any theory, in air quotes, I like to say coverage. You are getting discounts, and that is a form of coverage during that, while you're trying to meet that deductible, but in essence, you are responsible to meet the deductible before you receive any cost share or coverage from the insurance company. Once you meet the deductible on option 1, the plan pays at 100%. Now, I typically, being in this business, like to focus on the worst case scenario, and then I can always whittle down or step backwards. But if I know my worst case scenario, that's something I can always, know it can only get better from there. So out-of-pocket max is your worst case scenario. It is the maximum that you will spend out of your pocket for covered medical, dental, or I'm so sorry, I keep doing that. The maximum you will spend out of your pocket for covered medical expenses. So in option 1, the most I will spend is $4,000. If I have dependents, I have a shared, or in the industry what's called unembedded deductible, meaning that me and my dependents share one $8,000 deductible. If I go into the hospital for 30 days, then I know, let's say we haven't met our deductible yet, I know my hospitalization is going to cost my family $8,000, but I also know at that point then I'm done for the year. I have exhausted, I've spent my out-of-pocket max, and so now I know that the remainder of my expenses for the calendar year are covered at 100%. So again, all of my expenses go towards my deductible. Once my deductible is met, my plan pays 100% of my expenses thereafter. Again, option 1 does allow me to open up an HSA account. Option 2, HSA plan also lower deductible, 100% coverage after the deductible. The difference being is after the deductible, we introduced low-cost copays for traditional services. So option 2 is going to offer the lowest out-of-pocket, okay? Still works like an HSA in which all of our expenses apply towards our deductible. We still get the benefit of significant discounts by seeing network providers. And again, this plan allows me to open up an HSA. Option 3, mentioned it earlier, it's more like our traditional copay plans in that we don't have to meet our deductible. We get copays for things like doctor's visits and inexpensive prescriptions. We do have a small prescription deductible for our middle tier and more expensive medication. So option 3 is good for someone who's looking for first dollar basic care and doesn't want to have to meet the deductible. The trade-off on option 3 is that my worst case scenario, that out-of-pocket maximum, is a higher number. The positive of option 3 is if I have family members, I am capped at a per person deductible. So in my example in option 1, if I had surgery for 30 and I was in the hospital for 30 days, which we know that's a big, 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 big medical bill, I'd mentioned that if I had not met my deductible already, I would end up in option 1 incurring an $8,000 family deductible. Now again, after that deductible has been met, everything's covered at 100%. With option 3, I have, in that same scenario, because I have a per person or embedded deductible, I would only pay $4,250, the individual out-of-pocket limit. My $4,250 deductible expense, or out-of-pocket expense, would go towards the maximum of the $8,500 for the family. So at the end of the day, I do tend to focus on the blue bar, how much is my worst case scenario, and then I sit back and I think about my utilization and how likely I am to get there. I tell people if you're super healthy or super sick, if you're super healthy, option 1 will save you some money out of your check. And don't worry, all of the pricing is available to you when you log into the portal. So if you're super healthy and you want to just save a little bit out of your paycheck, that you want the lowest cost plan, that's going to be your option 1. If you have some significant medical needs, or let's say you're maybe pregnant, you have a known medical expense that's going to probably lead you into the hospital, or outside of a doctor's office, you're going to need more significant medical care, or you want to open up a tax-free account to help you pay for that medical care, I'm going to suggest probably option 2 for you at that point, because option 2 has the lowest out-of-pocket limit, and it does allow you to spend the majority of those dollars if you put the money aside on a tax advantage basis by having an HSA account. Option 3 is for that person who says, not sure where I'm going to be, but what I do know is I want a fixed copay for doctor's visits. I just want to know when I go to the doctor's office, it's $30. I understand I'm taking a gamble and having a higher out-of-pocket. If something bad happens, I'll spend more. But I really don't think anything bad's going to happen, and I want to spend less for simple stuff. So very often, option 3 would be your best bet there. Please remember that we have lots of other information about our plans, as well as an expanded menu of covered services and summary of benefits and coverage found at our employee site at workforcenow.adp.com. Under our medical, dental, and vision, we've given you a couple of little tools that you would not otherwise maybe glean from the information that's provided from the insurance company. So I wanted to hit a couple of the highlights. But remember that these 3 sections are available to you under the medical, dental, and vision section in our guide, and are designed to help you get more out of your benefits and understand how to avoid problems. One thing I'd mention is that all of our medical plans have free preventative benefits. All of our medical plans include Motivate Me, which is our new and robust wellness plan and incentives and reward program. I've given you some tips on how to lower your health care expenses, as well as a few important tips about utilizing your health plan, and I would encourage you to be familiar with those. If you're on prescriptions, I'm going to encourage you to come and take a gander under our RX tips. Prescriptions make up 20 to 30% of the total dollar of healthcare dollars spent these days, so it's super important to be savvy about prescriptions, know how to save yourself some money. We also recommend that you learn how to get the most out of your plan by knowing where to receive care. You don't have to compromise quality of care to be savvy about where you receive care. So a couple of things that I wanted to mention is, number one, depending on what type of care you need, you just want to be familiar with where to go to receive the right level of care, but at the lower cost to you. So for example, I needed an MRI some time back, and originally my doctor was going to send me to the hospital, and I said, no, 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 I want to go to an outpatient imaging center. I know that's going to save me money. Either place I go, it's going to be a deductible claim, so I knew I was going to have to pay for it myself, so I certainly wanted to go to the place that was still high quality but lower cost. We also have cost estimators, so that if you're in the HSA, number one, if you'll log into Cigna and create a user ID and account with Cigna, you can actually utilize Cigna's proprietary cost estimator tools for all of your care. It'll give you an identical cost within pennies or low dollars difference of what you should expect to pay for doctor's visits and prescriptions in your area. You can also use pharmacy cost estimators. So for example, I have had some people say, hey, I heard about this really cool tool called GoodRx.com, in which a friend of mine had a $300 prescription that only cost them $60. And GoodRx is a great tool for that. Just please do realize when you're using coupon sites or discount prescription sites, the expenses that you incur for the prescription may not go towards your deductible. So if you're buying the prescription outside of your health plan, you might lose that deductible credit. However, if I have a $300 prescription and I can save $240, I probably, personally, you don't have to, but I would probably make that trade-off. Just want you to know that that's probably the only negative, but it certainly saved my family some money. When I get a good enough savings, I always forego the insurance and use my coupons. Like to talk this about self-care. Someone that followed me, I spoke at a large convention one time, and someone that followed me called this Mommy Medical. And essentially it's just saying, to implore good practices that help you stay healthy and help you to care for yourself and not be as dependent upon medical care when it's possible. Again, I mentioned I love this benefit, Teladoc. If you have option 1 or option 2, to me this is a no-brainer option. Teladoc only costs $4.62 per pay period for you and your family, your household, so mama, daddy, children. And what's more is it costs nothing to use. The physicians are able to write prescriptions for simple medical conditions. Some we've been surprised about. One of the girls in my office actually had a daughter who had strep throat. That normally requires a culture, but depending on your symptoms, the doctors are pretty darn good about ascertaining some of those common ailments. And so my girlfriend was able to speak to a doctor in the evening and get a prescription that evening and get her daughter well on her way without missing any time from work. As an example, I've used it myself. I love it because I don't like going to the doctor's office and I don't like to be idle. And so Teladoc gives me a lot of freedom where I might be otherwise confined to sitting in the doctor's office for hours at a time. I'm actually able to receive care anywhere 24/7, 365, with the exception of Arkansas. Arkansas does have some limitations about Teladoc. Dental plan. Remember, we've given you tips about the dental plans. These are the same dental plans that we've had in the past. Very fortunate. This is a very unique dental plan in that it allows you to choose from one plan to the other. So I would highly encourage you to understand where it might be beneficial for you to pick one plan over the other. The PPO plan is ideal for the person who wants complete freedom about where they receive their dental care. So the PPO is ideal for that person who says they want to go, it's really any dentist, or they may need child-only orthodontics. With the PPO plan, the maximum benefit that the insurance company will pay is $1,500. The most that you can receive for child orthodontics is $1,000 of coverage. The deductible applies. We have a $50 deductible, $150 family deductible, and it applies to all non-preventative services. You have no waiting periods in this plan, which is super fantastic. Preventative benefits are covered at 100%. Basic services are covered at 80. I typically refer to basic services as what's called fill and drill. And then major services are covered at a 50%. Major services are going to be your big ticket items, crowns, bridges, root canals, the fun stuff, the more expensive fun stuff. Again, you do have child-only orthodontics. You have no waiting period for that as well, and the benefit is paid at 50% to a max of $1,000. So the value becomes picking the DHMO. If you need more dental care than $1,500 will cover. Oops, sorry about that, guys. So you need more dental care than $1,500 will cover, or you need adult orthodontics, because adult orthodontics are covered under our DHMO. So that's the big value, or the big win to the DHMO, is that we offer adult orthodontics, and there's unlimited benefits. The DHMO, you must commit to the network. There is no out-of-network benefits, and you will need to get referrals from your primary dentist for specialist care. So with the DHMO, that would be your trade-off for unlimited coverage or adult orthodontics. You are making a commitment. Again, same network, so not that big of a deal there, in my maybe never humble opinion. So 2 great dental plans. Now I'm going to really probably surprise you, because one of the neatest things about your dental plans is you're allowed to switch from one dental plan to another throughout the year. So if you had the PPO and you exhausted your $1,500 of benefits, you could switch to the DHMO for the rest of the year, knowing that you have unlimited coverage there. As well, let's say you have the PPO and you are an adult and want orthodontics. I would switch to the DHMO. Or if you utilize the DHMO and all of a sudden you've met the world's best, most awesomest, fantastic dentist, and they're not in the network, then you can switch over to the PPO. So lots and lots of freedom there. Remember, you have free preventative benefits. The mouth is the gateway to the body, so I would encourage you to always take advantage of your dental cleanings. It's super important. They can detect many diseases through a thorough and comprehensive dental exam in early stages, which we're all about prevention. Remember, we've given you extras, tips on how to lower your expenses, and just overall plan tips. Vision benefits. Okay, again, very identical coverage. This is going to be a switch to Cigna for the 2017 plan year. It will be their network, but ultimately this is the exact same coverage that we were being offered from our renewing plan with Humana, for those of you who might be joining the webinar that have been covered under our plan in the past. Great plan, very comprehensive, low-cost eye exam, copay for hardware. You have single, bifocal, and trifocal lenses are covered at 100%. Some additional lens enhancements are covered for children, as well as you get a $130 frame allowance. After your $130 frame allowance, 20% of any upgrade is discounted off of the cost of this frame. Elective contacts are covered at $130. And we do encourage you to purchase your contact lenses in full, as well as to spend 100% of your contact lens benefit at once, as well as you can purchase your contact lenses from any provider. So wherever it saves you the most amount of money. You have frequency limitations, as we do with our dental and sometimes in our medical plan and our vision plan, our critical illness, and our biggest frequency limitations with our vision plan is that benefits for an eye exam are covered once each 12 months, not once per year, but once each 12 months, lenses once each 12 months, and frames once each 24 months. Please do note on the dental, as an example, which was under one of your tips, cleanings are covered once every 6 months. Okay. If you select option 1, 2, or 3, we mentioned, sorry guys, let me get back over there. We mentioned that you had HSA, you could open up an HSA account. So if you can open option 1 and option 2 allow you to open an HSA account. I'm going to go over what that means in general, but basically a health savings account is a pre-tax individual bank account that allows you to put money aside to pay for eligible health, dental, and vision expenses out of your pocket. There are contribution limits. This is money that you are deferring out of your check on a tax-free basis. There are a couple of parameters that allow you to qualify for an HSA, one of which is to have option 1 or option 2 health plan with us. And then if you're over age 55, you can do a $1,000 catch-up provision, as well as if you have a spouse, they may also be able to do a catch-up provision. We've given you some tips about opening an HSA, making HSA contributions, HSA and taxes, and how to use your HSA and health plan together. So I'd encourage you to become familiar with those. Most importantly, if you have a health savings account, qualified health plan, option 1 or option 2, I'm going to strongly encourage you to have an open account. You don't have to fund it to the maximum. You don't have to put in all of this money. You just need it open so that if by chance something happens to you and you find yourself with a significant medical bill, you're able to put money into it, funnel it into the HSA in order to pay for those out-of-pocket expenses. So the biggest key is to make sure your HSA is open when you have a medical claim. The money doesn't have to be in the HSA. The HSA just needs to be open. So if you want to put $100 into your HSA, $120 into your HSA, you can stop your funding after $120 and let it sit there and just know if anything big ever happens, you're going to probably want to save taxes on those big expenses and run that through your HSA. If that all sounds Greek or foreign, it's okay. Call the Resource Center and we can help explain it to your personal situation. We've given you some examples of qualified expenses that apply to your HSA. I always tell everyone if it's covered by your medical, dental, or vision plan, it's a qualified expense. It's all the other stuff in between that maybe you're not familiar with. We've also given you some examples of non-qualified expenses, and the thing I would tell you the most often are going to be things like supplements, health club membership dues, or something cosmetic. A lot of people understand what an FSA is because FSAs have been around for a long time, but maybe get them mixed up with HSAs. So we've given you a little chart to help explain the difference between the two, and remember that we offer an HSA to you if you have option 1 or option 2 health plan. We do offer supplemental life insurance. Remember, during this open enrollment, it will be guarantee issue. You can elect up to the maximum level without any questions asked. This is a privilege that we were able to obtain for you, so I'd encourage you to take advantage of that. New hires will always get that privilege when they are newly eligible, but during this open enrollment, this guarantee issue level is available to you. So if you maybe didn't elect as much life insurance as you needed in the past, or maybe you found that you have a need, or maybe you found yourself uninsurable, I would encourage you to consider getting the life insurance through Pyramid. The other nice thing is if you elect some this open enrollment, no questions are asked. So even if you've got simple medical conditions that can otherwise preclude you from getting life insurance, You can get it through Pyramid, and no questions asked during this open enrollment. Or if you're a new hire, if you make your election and you elect some level of coverage but less than our guarantee issue amount, then during open enrollment you can add additional amounts of benefits so that maybe as your needs change, you're able to adjust your life insurance amount to reflect that change. Giving you a couple of beneficiary tips. They're super important, whether this is life insurance at work or life insurance at home. I would encourage you to be aware of those beneficiary tips. And by the way, our life insurance is portable, meaning that you may be able to take it with you when you leave. Not that we want you to, but if. I just encourage you to name the right beneficiary. Keep your beneficiaries up to date. There's nothing more sad than maybe an ex-spouse receiving something that maybe should go to anyone but that person. And remember, you can change your beneficiary at any time. And then we do encourage you to name at least 2 beneficiaries. The remainder of the tips are good ones, but those are the best ones. Employee Assistance Plan. Love this benefit. It does give you access to resources and counseling services to help you with some of life's biggest challenges. I would encourage you to take advantage of our EAP. And one of the biggest, I'm going to highlight a couple of our really big things. We have identity theft benefits included, free will preparation services included, and 3 face-to-face counseling sessions per year. So I highly encourage you to take advantage of our EAP. You can simply click on the link and log in by using the code MEMBER. It's a great, great benefit that is a little underutilized. Disability. Disability benefits are just simply income replacement. If you're unable to work, they help you to keep a paycheck coming along. We have short-term and long-term. You can pick both or one or the other. Short-term covers you after 7 days, on the 8th day, and up to 12 weeks. Please note there is a 12-month pre-existing condition exclusion for the short or long-term disability. If you're re-enrolling during our 2017 open enrollment and you had the disability before, this is not a new 12-month period. So how much ever time you've been covered, you are receiving credit for that. The short-term pays 60% up to $1,500. The long-term pays up to $15,000. They're very inexpensive disability rates. Individual disability is easily 10 times the cost of what our disability costs. So I encourage you to take advantage of this most important piece of a solid financial plan. Critical illness benefits. These are benefits, I liken them mostly to, number one, it's supplemental coverage. It pays no matter what health plan you have. Remember, everything is a la carte. You can have no medical, family dental, single vision, everything is a la carte. With our critical illness, it helps to cover acute medical conditions such as heart attack, stroke, coronary artery disease, heart failure, invasive cancer, end-stage renal failure, organ failure, or other covered illnesses. And it simply pays you a lump sum based on the amount that you elect for you, your spouse, and or your children upon the diagnosis of one of those covered acute conditions. The benefits are paid directly to you. They're payable regardless of other coverage. There are reoccurrence benefits included. This one I love the most. There are wellness benefits included. So if you get a free wellness exam with your dental or your medical plan, they'll actually pay you $75. The cost of the actual exam up to $75, even if you didn't pay anything for it. The benefits are also portable. Please note that we have an open enrollment provision during open enrollment this year, and as always, to all newly eligible employees, i.e. new hires. This is certainly an opportunity for the folks that have been around for a while who might have missed the opportunity to get the critical illness in the past. Our open enrollment provision for 2017 will allow you to elect critical illness without any questions asked. Please note there is a 30-day waiting period to make a claim against our critical illness. Finally, we have a great retirement plan offered by Net Benefits with Fidelity. You have the opportunity to put away as much as $24,000 per year into a retirement plan. There's tons of tools that help you. If you have trouble, if you want to view frequently asked questions, or just simply access the guide to Fidelity Net Benefits. If you're not ready for retirement, our retirement plan and resources can help. Even if you are ready for retirement, you probably can be more ready. We call it more better here. All right, our employee site. Remember, it's workforcenow.adp.com. It's available 24/7, 365. Tons of information, probably more than the old Southern saying is you can shake a stick at. If you are going there for the first time, I'm going to jump over and just make sure that you are familiar with how the site looks. You can register here, or you can log in. And if you forgot your user ID or password, you can click the link there. We did also create 2 videos for you. One is how to register with ADP, and the other is how to conduct an open enrollment or new hire event in Workforce Now. So I just want to encourage you, if you feel like you're stuck a little, you're welcome to stop over at our links that are in our book to take a quick video tutorial. And those links are down here at the bottom. Giving you a quick overview of how to enroll and navigate the site in our guide. Oops, sorry, guys. All right, and then we're going to be wrapping up soon here. So just want to reiterate, we are going to be ramping up our motivation, our efforts for wellness, including offering and rolling out a new Motivate Me program. You'll get more details about that, but ultimately you will get incentives if you engage in healthy lifestyle choices. So you'll earn rewards for doing good things for you. And imagine that. Once we roll out the program, this will be our steps. You'll see more information if you're watching this video prior to May of 2017. Just know that more information is coming. If you're watching our workshop video after May of 2017, let's get started. Don't delay. This is a great benefit, and it'll help put a little bit of reward in your body and a little reward in your pocket. After open enrollment, we ask you to do a couple of things. Check your paycheck. Make sure it's correct and it reflects the benefits you intended to enroll in. Call or log into the plan's website and confirm your enrollment and your dependent coverage. When we audit our records, we don't get everyone's dependent names returned to us. We get that Glenda, for example, me, has employee spouse and employee spouse coverage. We don't know if I have children. It just is going to say that we have children coverage. It's not going to list them independently. There's a lot of data that's passed. This is a no small task. So I would encourage you just to make sure that you do log in and check your enrollment with Cigna or Teladoc. If you fail to continue to meet eligibility requirements, then you have, for the most part, likely the opportunity to continue your benefits through a conversion, continuation, or portability feature. If you think you have a loss of eligibility, contact our Resource Center and we'll help walk you through your rights and your responsibilities in order to maintain coverage. I'm not going to spend too much time here because I don't know that this will be the same tomorrow. But do know as of today, what you see it before you is accurate. If you're working on Medicare, this is a great resource about who pays first, Medicare or your employer plan. We do provide a lot of information that is a supplement to what we went over today in our benefit guide. So I would encourage you to, again, log into Workforce Now to access all of the documents, resources, tools, and information that we have put out to Workforce Now to help you be educated and informed about all of the benefits that you have available. Most importantly, I'd like to remind you that we are your resource center. We are here to help. So if you have any questions, if you have any issues, claims question, claims issue, don't understand something, think you've had a qualifying event, just don't know, have an insurance question, call us. Have a financial question, call us. We are here to help. We are your benefits counselors and your resource center. Again, our number is 770-716-3200. Our email address is info@resource7.com. We'd love to help you guys. If you'd like any type of assistance one-on-one with making your benefit selections, whether it's during open enrollment or as a new hire, please feel free to give us a call or shoot us an email to schedule some time, or just pick up the phone and we'll answer your inquiries on demand. Please remember, our plan year starts April 1st, 2017 and ends March 31st, 2018. We encourage you to log into Workforce Now today and get your election made to avoid default enrollment and take advantage of all of the special opportunities that we've created for you guys for the 2017 plan year. And in closing, I'd like to just remind you that there's a tremendous amount of work and money put into getting us where we are in offering our benefits for the year. And I would just highly encourage you to let people know that you appreciate their effort. Our HR team, our HR executives, our owners, our leaders of our company. We have Ramesh Maturu, Sanjeev and Namita Tirath, Anup Sinha, Lisa Grinham. Lots and lots of folks have put effort into this renewal process to make sure that we are as competitive as possible in our benefit offering and provide you with a great choice of benefits and menu of options at the very lowest cost possible while still providing the best value. Lots of work and money have went into this, and I can tell you from experience, if people know that it's important to you, they make it important and maintain an importance to it as well. So people like to know it's appreciated and it's important, and it'll go a long way when we look at our future years. So I'd highly encourage you to drop a note or maybe just send an email and let someone know, or give a little quick call and let someone know how much you appreciate the hard work and the money that's being spent on your behalf. I'm going to sign out now. I'd like to remind you guys we're here, and we're here to help, and we want to help. So take advantage of us. We've got our average staff member has more than 16 years of experience. So I don't know exactly what that says, other than we're supposed to be pretty darn smart. And I tell you, more than anything, we care. And we're happy to help you guys. We've been fortunate to work with your company for many years, and feel blessed and appreciate that opportunity, and want to continue to help Pyramid and help you as a valued employee to get everything you can out of your benefits. Thanks again, and have a great day.